Welcome to the TRT and Hormone Optimization YouTube channel. And as a guest today, we have back with us Jeffrey Ruterbusch. Welcome, Jeffrey.
It's great to be back, Steve, and I hope you're having a wonderful weekend.
We have, thank you. So let's talk about antidepressants today. The question was, we got it from a viewer, do SSRI antidepressants and other types affect testosterone levels?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
The short answer is yes, and the long answer is yes. But here's the controversy. I had to go into a lot of research, both my testosterone journals, my testosterone books, my andrology journals, and believe it or not, I even had to go in my psychiatric textbook to get a hold of my cousin who's a psychiatrist. But yeah, there was a study done in 2008. It came out in the Journal of Clinical Psychopharmacology, March of 2008. And that's the best study I found, methodologically speaking, to corroborate the finding that indeed all antidepressants, but in particular the SSRIs, do create hormonal abnormalities in men. In particular, they tend to decrease testosterone and decrease LH and decrease FSH and increase prolactin. So the answer is yes, even though there is some evidence that it's maybe controversial still. Like I say, the majority of evidence I found supported the fact that there is a disruption in the hormonal milieu. And when I spoke to my cousin, who was a dual-boarded psychiatrist, he indeed corroborated that finding with me.
So, and is there any solution to that if people really are depressed and their doctor has to prescribe that to him? Do they have to get on TRT?
First of all, you're looking at someone as an orthomolecular physician that doesn't really believe in antidepressants because, one, you may or may not know this, but it's been the whole theory of neurotransmitter imbalance or brain imbalances is false, never been proven. In fact, there's evidence saying that it's erroneous. So, in essence, antidepressants of all forms don't fix any chemical imbalances, they create them. And it's been shown, numerous books I have on my shelves that they're based strictly on placebo effect, solely. And that placebo has been shown just to be as effective, and exercise is more effective than antidepressants. So again, all antidepressants create hormonal imbalances. Now, you probably know as well as I do that there are a bunch of drugs that create hormonal imbalances. Ketoconazole is one, it's antifungal. Tagamet is another one, cimetidine, spironolactone, opioids, statins. They're well documented to create hormonal disruptions in men and women. Of course, we're talking about men's testosterone today, so we'll keep it relevant.
So if men come to you as a doctor with low testosterone symptoms and they are taking SSRIs, for example, do you take them off?
Yes. Now, I try to, because I'm not a proponent of any antidepressant, but, some people are in love with their antidepressants, and some feel, some people are getting disability based on their rating of depression, and so they feel that they can never come off it. They'll lose the disability rating. It's been shown that when you try to come off the antidepressants, for several months, you have significant withdrawal syndromes from coming off these antidepressants, in particular SSRI. So no, I try to dissuade anybody from being on antidepressants, and I turn them on to many research articles I have in textbooks that have disproven the neurotransmitter chemical imbalance in the brain. Never been proven. Never.
Okay.
Right?
I agree.
I'm glad you do. Because no, I've never prescribed antidepressants. I try to get men off. But most of the time, Steve, you and I know, if you got a guy who's depressed, you put him on, he gets heart testosterone optimized. Guess what happens? He's no longer depressed.
Yeah.
So
exactly.
Yeah.
And now give this video a thumbs up and go watch one of these videos to learn a ton more about TRT and hormone optimization.